It is now time for our weekly segment, but Tell It Like It Is, where ABC News contributor Dr. Alok Patel shares health advice on the topics that matter most to you. And today he's answering some of your questions. So, Dr. Patel, take it away. What do we need to know?
Well, Diane, once again, we got a lot of great questions. Seems like COVID is back in the spotlight, but there's a little bit of a fun cosmetic question we'll get to. First question, which I think a lot of us are asking, is basically about the COVID origin that's happening. Simply says, does COVID's origin really matter? What would that change? This is a question that comes in from Ty from Phoenix. Now, simply put, it would not change what has happened during the pandemic and how many millions of people have been infected or died. Right now, the two prevailing theories that seem to be debated are a lab leak theory or animal transmission. Diane, if it is proven to be lab leak, we need to have a bigger conversation about biosafety and protocols and how that potentially happened. If it is from animal transmission, that may help with more information about preventing the next pandemic. So remember, zoonotic infections, things like Lyme disease, rabies, even some versions of influenza, can help us predict what's going to happen. But in any case, we need to pay attention to both and be much better at preventing the next pandemic and having a more scientific and not political debate.
And better at communicating about it, perhaps?
Maybe communicating about it and paying attention to our healthcare infrastructure, which caused all the problems to begin with. But we're watching that fiery trial happen, and I'm hoping that more science is injected into it.
All right.
Next up, we have another question, which I think millions of people are asking. This comes in from Alfredo from Miami. I've had joint pain and fatigue. How do I know if it's long COVID or if I'm just getting old? You know, Alfredo from Miami, given the fact that surveys show that about 1 in 5 people are experiencing symptoms of long COVID, you aren't alone in this question. Now, if we do a quick overview of long COVID, this represents over 200 different symptoms. They can appear weeks, months, they can last for an extremely long time, and they're affecting a lot of people, with some people being higher risk. Now, I think one important question people need to ask, if it's been about a month since you recovered from COVID and you still have symptoms, shortness of breath, headaches, joint pain, it's important to go and chat with a doctor to kind of get an assessment. Our doctor will make sure that you have no other underlying medical conditions, that you've previously had COVID-19, and your treatment will be individualized. But hey, if you're getting old and you have joint pain and COVID didn't change that, it may not be long COVID. It's important to take a good look at your own assessment. But Diane, I think we're going to be having a much broader conversation about long COVID in the future, because a lot of people are coming out and complaining about long-term symptoms.
Yeah, a lot of questions still there, and I'm sure they're not easy to answer.
And I do have another one that we're going to get a little cosmetic on this, and I might be involved in this question. This question comes from Emily in Del Norte, Colorado, simply saying, why do gray hairs suddenly appear? Can we prevent them? Diane, I asked this question because if you can see on the right side of my head, there is some silver fox happening on me. Now, we don't know if we can really prevent gray hairs. We don't know if it actually matters, because we should be able to age gracefully. According to dermatologists, melanin is what produces the color in our hair, and over time, the amount of melanin produced from our follicles decreases. There's a natural decline. This is mostly related to age, genetics. Smoking can actually worsen this, so yet another reason to not smoke. There are certain medical conditions like thyroid disease that can cause premature graying, vitamin deficiencies such as B12. And I want to focus on this last one about stress, which seems to be an academic debate. It is unclear whether or not stress can directly cause gray hair. Stress can cause your hair to turn over more quickly and fall out more quickly. That may accelerate aging of your hair. And in mice, poor mice, stress was found to cause gray hair, but not sure if it does in humans yet. But I think the message is control your stress, because from head to toe, that's just basically good for your body.
How is children not on that list? Because let me tell you, in pregnancy, you keep all your hair while you're pregnant, then you lose it after you have the kid. You have all this weird scenario going on up here. And after my daughter, it feels like every hair that came back is gray. So I think you need to add
you're talking about, Diane, because your hair looks gorgeous. I do not know what you're talking about. Your hair looks phenomenal. whatever you did was the opposite of what other people.
They're literally yelling at me, rap, rap, rap. I'm like, please carry on, carry on. All right, Dr. Patel.
Dr. Patel's white hair.
I love you, little silver fox.
White hair off camera.
I think your daughter gave you those too. I'm standing by it. Dr. Patel, thank you. And if you have any questions for Dr. Patel, we do this every Friday, so leave him a message on our Instagram, and he just might answer your question live on air.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.